I was asked to present his lecture today. Professor Akutsu is working in Chiba University, and he is a radiation oncologist, and not just an excellent clinician, but also a good research scientist, concentrating to treat esophageal cancer. So in this talk, he will summarize his basic research results together with his first clinical experience in this topic. Unfortunately, the esophageal cancer survival time is very, very little, even when the multimodality treatment, the gold standard surgery, radiotherapy, and chemotherapy is performed. The reason of this pure survival time is the extreme aggressiveness of this esophageal cancer. It can create a lot of highly aggressive metastasis. So the question arises that after all these treatments are failed, what is the other option that can be developed? Professor Akutsu's first study focused on the intratumoral administration of dendritic cells together with local radiotherapy. According to his idea, this combination can elicit abscopal effect. I think almost everybody knows nowadays what abscopal effect means. It came from the Latin word ab means position away from, and scopus, mark, or target for shooting at. So the abscopal effect, which was defined as a significant tissue response to radiation that occurs beyond the radiation field. It was revealed almost 60 years ago, and at that time it was absolutely not clear which mediate this kind of effect. Recent research results revealed that the underlying mechanism of the abscopal effect is immune-related phenomenon, because radiation can induce secretion of different kinds of cytokines and can induce a special form of cell death, which can also induce inflammatory signals. So recent studies suggested that the mechanism of the abscopal effect is highly T-cell mediated. To test this hypothesis, Professor Akutsu believes that the combination of intratumoral dendritic cell and radiation can be highly beneficial. So can a combination therapy of intratumoral administration of dendritic cells and irradiation induce effective antitumor effect against local and against systemic distant tumor? To test this hypothesis, he designed a simple study, a mouse study, using a squamous cell carcinoma cell line inoculated into the leg subcutaneously. And radiation was given at day 6, 7, and 8. And after the irradiation, dendritic cells was administered intratumorally into the leg. And here you can see the result. It was really very surprising. The control tumor grows in a very high extent, but the irradiated and dendritic cell treated tumor almost completely disappeared in this experimental condition. So to answer the question that this effect can be systemic, he designed another study using the same squamous cell carcinoma cell line, but two tumors was inoculated in the same mouse. One tumor was treated, was irradiated, and the dendritic cell was inoculated intratumorally, but the other tumor was absolutely untreated using any direct treatment. The treatment schedule was similar like previous. On day 6, 7, and 8, irradiation was given, and after 5 times dendritic cell administration was done intratumorally into the treated tumor. And here we can see the result. The combination treatment can be able to dramatically decrease the tumor growth on the far distant tumor, which was not treated at all. According to Professor Akutsus, the underlying mechanism can be a very interesting phenomenon, what we called co-presentation of antigens. And the key molecules in this process is the GP96, a kind of heat shock protein, a kind of chaperone. And when it is recognized together by the dendritic cell or antigen-presenting cells, it can induce a very, very strong specific T cell activation. Using the Western blot analysis, he revealed that after irradiation, 2 days after the irradiation, the GP96 level was dramatically increased on the irradiated tumors. The immunofluorescent assay also revealed this strong overexpression of the GP96. Here you can see the ballooning of the tumor cells and the highly elevated GP96 expression level. So, concluding his first study, we can say that the intratumoral administration of dendritic cells together with local radiotherapy treatment can really elicit abscopal effect. The problem is that his patient from the clinic has already underwent radiotherapy, so no additional radiotherapy can be added. So transferring to this method to the real clinical practice is a little bit problematic. So that's why Professor Akutsu started thinking how to solve this problem, and he strongly believed that this dendritic cell therapy together with hyperthermia treatment can also elicit abscopal effect. He also designed a nice study to prove this theory using the same model, the squamous cell carcinoma tumor cell line, and he also induced a double tumor model. Oncothermia treatment was performed on day 9, 11, and 13 after the tumor cell inoculation, and dendritic cells was administered intratumorally on the leg after the oncothermia treatment 3 times. And tumor size measurement was performed. Here you can see some representative photographs about the mouse. This is the untreated control mouse group. This is dendritic cell alone. This is oncothermia treatment alone. And this is combination. So significant tumor size suppression was achieved. But what is really very shocking when we check the distant tumor, which was not directly treated at all, the combination group, this absolutely untreated tumor totally disappeared, while in the control group it grows dramatically into a high, really very large size. This is in a graphical form his result. So this is the treated tumor size, this is the control, and here you can see the combination treatment. And this is the chest tumor, which was not treated directly, and also highly significant tumor volume loss was observed in this case. Professor Akutsu also wanted to know what kind of lymphocyte population can be observed in the draining lymph nodes of the tumor. So after the tumor excision, he performed a flow cytometry analysis to reveal the cell population in the tumor. Here you can see the control group, and here you can see the combination group, almost 5-fold increase of CD3 positive cells was measured. Also, dramatic change was observed in case of CD4 positive cells. The increase was almost twofold. And also, cytotoxic CD8 positive cells ratio was also dramatically increased. These are the cell population in graphical form. This is the combination group. The CD8 positive cells was significantly increased in this treatment group, while the FOXP3 cells, which is the regulatory T cell population, was dramatically decreased. Professor Akutsu published his interesting research in this paper, so everyone who interested in the fine details can find this publication. So now let's focus on his clinical research. For clinical application, Professor Akutsu's team try to achieve any beneficial effect. And as a clinician, he also wants to concentrate into the immune-related phenomenon. So he performed a phase 1 study using an EHI 2000 device for unresectable recurrent esophageal cancer patients. These are the eligibility criteria for the patients. So just very briefly, recurrent esophageal cancer progression, which has been demonstrated to be a squamous cell carcinoma tissue type. Prolongation of survival cannot be expected by conventional surgery, chemotherapy, radiation therapy, which are covered by the health insurance. So basically, these patients were absolutely in terminal stage. Here you can see the schedule of his treatment. 2 times every week, one treatment was performed. In one course, one course takes 4 weeks, and he performed blood sampling and immunoassay, general blood test, and CT imaging was also performed on the day 7 and the end of the second course. And in this study, in this phase 1 study, he just concentrated on the evaluation of safety and to detect any adverse reaction of the oncothermia treatment in case of esophageal cancer patients. Treatments was performed in Chiba University Hospital, where the EHI 2000 device was installed first time in Japan. The treatment started in 2013, January, and the first case was enrolled, and this treatment was started on February. This is one of his patients. And really very interestingly, according to the immunology-related blood sampling analysis, in one of the patients, he revealed that after the second course, the Th1, Th2 ratio dramatically increased, as well as the Treg ratio decreased, and the cytotoxic T lymphocytes was also increased in this case. And monotherapy, oncothermia as a monotherapy was applied in these studies. These are all the enrolled patients which attended in this clinical study. So the status was unresectable or post-operative recurrence, and the target lesions was deferred. So lung metastasis, lymph nodes, and primary tumor was also treated. These are the list of the adverse effects. He experienced one skin surface burn and fistula formation 2 times. But most of the patients tolerated very well the oncothermia treatment. These are the summary of his results. So taking into consideration that these patients was basically in terminal stage, 4 patients status was stable disease, while 6 patients showed progression of the disease. The median survival time in this end-stage esophageal carcinoma is 152 days. But Professor Akutsu's, one of the patients of Professor Akutsu, the longest survival time was almost 560 days alive with a relatively good quality of life. So summarizing his clinical study, you can say that modulated electrohyperthermia or oncothermia is useful to prolong survival time in good quality of life, even in the terminal stage of esophageal cancer. Thank you very much for your kind attention.